Once again, I'd just like to welcome you today to MDFA's webinar, Living Safely with Low Vision. As I mentioned, we have two presenters today. We have Priya Narayan and Catherine V. And I'm very excited to now introduce our first speaker, Priya. So Priya is a highly experienced clinical orthoptist, having worked at several tertiary referral hospitals, private ophthalmology clinics, and low vision services. More recently, Priya has worked as an educator at the University of Technology, Sydney, and is currently working as a healthcare professional education manager here at MDFA. Welcome, Priya.
Thank you. Thanks, Niv. Hello, everybody. As Niv mentioned, my name is Priya, and I'll be presenting the first part of this webinar called Slips, Trips and Falls, and the emphasis, of course, is on falls today. Just a very quick reminder, like Niv mentioned, that the information myself and Catherine are presenting is very general in nature. But if you have any specific questions you'd like to ask about your vision or your eye health, as well as your falls risk, please don't hesitate to contact your eye care practitioner or your GP. So what's on for today? This is what the program looks like. So first of all, I'll talk about what a fall is and where these falls are occurring. We'll talk about the different risk factors associated with falls, and then I'll spend some time looking at the specific types of vision loss that have been linked to increase a person's risk of falls, and of course all of this is for the older age groups. And finally, I'll discuss some practical ways to reduce the risk of falls from the vision perspective. After which I'll hand over this presentation to Catherine, who will be discussing practical ways to reduce the risk of falls from the balance and mobility perspective. So, what is a fall? The World Health Organization defines a fall as any event that results in a person coming to rest inadvertently on the ground, on the floor, or to a lower level to where they were. Falls are an important health issue for the older Australian. They're a major source of injury as well as hospitalisation. And I'll go through some numbers in the next slide. And here are the numbers. 1 in 3 people over the age of 65 have a fall in a given year. Falls are also responsible for 87% of injury and hospitalisation in Australians that are over the age of 85. Research has also found that individuals with vision loss are at double the risk of a fall. Now, I know I can't hear you or see you, but I do have 2 questions I'd like you to ponder over. First of all, is a trip a fall? And by trip, I mean if you trip over, for example, some low furniture or a loose bit of carpet or your shoes, is that a fall? And secondly, is it a fall even if you don't hurt yourself? I'll let you think over that. Now, if you answered yes to both those questions, you would be absolutely right. Near misses are really important to investigate, as it gives you, carers, family members, and healthcare practitioners the chance to investigate the cause. Also, we can investigate how we can change or maybe modify some behaviour or the environment to try and reduce the risk of a fall occurring, and of course to try and reduce the risk of an injury occurring. Now, where are all these falls occurring? Now, you would be forgiven to think that falls occur during a period of intense activity like exercising or when you're in an unfamiliar environment. But research tells us that most falls occur when a person is just walking along, minding their own business, performing routine tasks, and when they're at home. And this, interestingly, is the case for all adult age groups. For the older individual, over half the number of falls occur within their home. In one study, it was reported that within the older age group, 60% of falls happened within a person's home, 30% occurred within the community. So for example, if somebody was catching public transport or if they were at their shops, and 10% occurred in a healthcare setting like a hospital or a clinic. There are, of course, many consequences of a fall, be that physical injury or impairment and hospitalisation, and very importantly, there are psychological consequences as well. I've listed here the physical injuries that most commonly occur within the elderly after a fall. The first and most common being bruising, followed by soft tissue injury, and this means damage to muscles, ligaments and tendons, and a common example is a sprained wrist. Then we've got fractures at sites other than the hip. A fracture is a broken bone that can range from a thin crack to a complete break in the bone. Then we have head injury. This is injury to the brain, the skull, or the scalp. And then finally, 1% of injuries sustained during a fall are hip fractures. But as you can imagine, a hip fracture being such a serious injury leading to months of treatment, therapy, and pain, research evidence has linked visual impairment to major falls that cause hip fractures. There are the other consequences of a fall that I mentioned earlier. So even if you don't experience a serious injury or a lingering physical injury, you can also develop some psychological issues, such as the fear of falling again or the fear of injuring yourself, restriction to activity or activity avoidance, again, to reduce the fall occurring or reduce injury occurring, loss of confidence in one's ability to do certain tasks, increased levels of anxiety, reduced independence, and sadly can lead to social isolation also. The increased risk of falls within the older age groups is thought to be multifactored, and I've listed here the factors that contribute to a fall, and of course this has been found by research. So first of all, we have age. The World Health Organization tells us that the older age groups, that's over the age of 65, suffer the greatest number of falls. Previous falls are again a risk factor also. Visual impairment is a risk factor and one that I'll go in more detail shortly. Pre-existing medical conditions, for example, cardiac or neurological conditions, are a risk factor. Medications are a risk factor, for example, those that can cause drowsiness on sleeping medications, and gait or postural stability. And what that means is if someone has reduced lower limb strength. And finally, also the environment. So clutter, as well as poor and not enough lighting, are a risk factor for a fall also. So the take-home message from this slide is that there are lots of causes of a fall, and falls can occur from one or a combination of factors. And sometimes it's just simple bad luck. But each fall or near miss is really important, and it needs to be taken seriously to try and reduce the risk of it occurring again, and of course to try to reduce the risk of injury. So we'll talk about vision loss and falls now, but I wanted to give you an overview of the eye health landscape before I dive into the specifics. So 80% of vision loss is caused by just 5 conditions, and I've listed them here just in alphabetical order. So we've got age-related macular degeneration, cataract, diabetic eye disease, glaucoma, and refractive error. And as I mentioned on a previous slide, people with a vision impairment do have twice the risk of falls as their sighted peers. And if you couple that with other factors such as age, which leads to the normal aging process of brittle bones and reduced reflexes, you can imagine why vision loss and falls are an important health issue that we need to be aware of. Vision loss itself is a broad term and it includes many different types and levels of vision impairment. Vision loss can result from many different causes, and it is common, as many of you probably have lived experience, that it is common for an older person to have more than just one condition that has led to a vision impairment. In the next few slides, I'll go through some specific reasons why vision loss contributes to falls, and this, of course, has been found by research. The visual input you and I and our neighbour receive from the environment is thought to enable us to coordinate and plan our body movements, as well as maintain our balance. And research has pointed to the deprivation of this visual input, leading to issues with balance, as well as gait alterations. And what I mean by that is that a person's normal way of walking is altered or changed. So I've got here the components of vision that have been linked to increase the risk of falls. So they are central vision loss, vision clarity, and visual field loss. Visual field loss means side vision loss. And these can cause reduced balance or changes to a person's balance. They can alter the way a person normally walks, and it can impair our ability to detect hazards within the environment. So in the next few slides, I'll talk about which eye conditions or which eye diseases commonly affect these components of vision. So we'll start off with central vision first. The most common cause of severe central vision loss in people over the age of 60 within the Western world is age-related macular degeneration, or AMD. As many of you out there have first-hand experience, AMD causes a loss of detailed vision, the loss of the ability to read fine print, reduced colour and contrast sensitivity, to name a few. Everyday tasks like reading, using an appliance, cooking, self-care are affected in different ways. The loss of detailed vision can also make accidents or near accidents more frequent. We'll move on to vision clarity now. Cataracts reduce vision clarity, and in turn they reduce our ability to detect hazards within our environment. And as you are probably very well aware, cataracts are a very slow process of clouding which occurs within our naturally clear lens. The lens sits inside our eye. Generally, cataracts are caused by the aging process within the eye that we'll all go through. Distance and near vision is affected, and objects appear fuzzy and indistinct. People may also become sensitive to bright lights and glare. Now we'll stick to vision clarity and move on to refractive error. So not correcting a refractive error or wearing glasses that are too strong or too weak also reduce vision clarity. So what is refractive error? Simply put, it means your eye is having difficulty focusing light. This leads to a blurred image that occurs in one or all distances. And usually a refractive error is corrected by glasses, contact lenses, and at times laser. And finally, we'll move on to visual field or side vision loss. And a major cause of side vision loss is a disease called glaucoma. Glaucoma is a name given to a group of diseases actually that damage the optic nerve. The optic nerve is a very important and large nerve that sits behind our eye. It takes all the information from the eye into the brain for processing. Glaucoma causes a progressive side vision loss, and usually central vision is spared, but in some extreme cases it can lead to complete blindness. Now, the link between side vision loss and falls has been found, especially if side vision loss occurs in the inferior or the bottom part of a person's field. Now, as you can imagine, or you may even have first-hand experience, that if you're missing your side vision, especially if both your eyes are affected, you can have trouble judging distances, you can bump into objects or people on the side, you can trip over objects on the floor or have difficulty going up and down stairs. And that's just a few examples. So putting it all together, in terms of vision loss, not one specific type of vision loss, being central vision loss, vision clarity, or side vision loss, has been found to have a greater influence than the other when it comes to falls risk. And it doesn't mean that if you have vision loss, you're going to fall, but it does mean that your risks are just that little bit higher. So knowing and reducing your risks may mean looking at several different interventions and just being a little bit more aware. So we'll talk a little bit about reducing the risk of falls from the vision perspective now. So as many of you are very familiar with, when it comes to vision loss, every individual manages differently, and there is of course a different challenge each and every time. The bigger, bolder and brighter is a rule of thumb that is often applied to low vision, and when looking at falls, these principles can also be applied. So when we think about bigger may mean updating your glasses to ensure that you're getting the best possible vision. Bigger may also mean, so for example, multifocals and bifocals are fantastic, but if you're a first-time wearer or if you've had a recent change to script and it's quite a large change, just to be aware that it may take several weeks to get used to them and to be more careful going up and down stairs, for example. Bigger may also mean removing clutter and small items and furniture on the floor that can be a falls or a trip hazard. We're moving on to bolder now. Bolder may mean marking the edge of a hard to see step or a staircase even in a bold strip of colour, just to highlight each individual step to make it just that little bit easier and safer going up and down. Bolder may also mean wearing a hat and investing in a good pair of sunglasses to reduce unwanted glare, to make it just that little bit easier to see. And finally, brighter. Oh, sorry about that. Brighter may mean increasing lighting wherever possible to make frequently used rooms, pathways, or corridors brighter and just that little bit easier to navigate, as people with vision loss can need up to 2 to 3 times more light than their sighted peers. So putting it all together, so now that I've given you all this information about falls, what do you do if you have one? Where can you get support and advice? So the usual suspects are your GP and your eye care practitioner, low vision services to help you maximise the use of the vision that you have, as well as looking at all aspects of your life. The physiotherapist or exercise physiologist are really handy if you're concerned about mobility and balance issues. But you can always contact us here if you would like advice on how to access any of these services. So I thank you so much for your attention, and I'd like to pass you on to my co-presenter, Catherine, who will go through how we can reduce the risk of falls from the mobility and balance perspective. Catherine is a senior physiotherapist at Concord Hospital's outpatient rehabilitation clinic. Catherine has worked in the area of falls prevention for the past 8 years. This includes falls clinics, facilitation of the Stepping On Falls Prevention program, and running falls prevention exercises. Thank you, Catherine.
Priya, for the introduction. And today, I guess I will be covering falls prevention. And Priya's already gone and given quite a wonderful background to falls and about vision and falls. And she said it's multifactorial. So I'll actually be going through all the other factors that contribute to falls. But in actually deciding on what title I'd give to the presentation, I actually decided to go with staying active and healthy, because preventing falls is very important, and all the strategies to help prevent falls actually enables you to actually stay healthy and active, which helps you to live your life and to be able to get out and about. So it's very positive. It's not just preventing something that's negative, but it will help you in all other facets of your life. So it's well worth the investment. So we'll go through a few of the different factors, but the first one that I'd go through today is more about your mobility and your walking. So it is important, first of all, to reflect and have a think about your walking, whether it be walking inside your house, outside, how are you on stairs, and deciding, am I unsteady? Am I fearful of falling? Am I not as confident as I used to be? Am I not able to walk as far as I used to because my legs are getting tired? Are you having a few near misses? So near misses being times when you've almost fallen, but you've managed to catch yourself. Have you almost tripped over on uneven pathways outside a couple of times? All of these indicators will point to you that perhaps your walking isn't as good as it used to be, and it's perhaps time for you to see a physiotherapist. And you can approach your GP and ask for a referral. So your physiotherapist would be able to assess and let you know what your walking is like at the moment, and perhaps what you need to work on in order to improve your walking. And that might mean exercises, and I will go through that in the next slide. And potentially it might mean walking aids, and that could be a walking stick or a walker. And that may just be an interim measure until you actually improve your walking, but the physiotherapist would actually be able to give you some feedback about that. So I think that's a good place to start. Okay, now what sort of exercise am I talking about? There is a perception that people will perceive walking as an exercise, which it is, but it isn't the exercise that will help you stay on your feet, not lose your balance, and not to fall over. So all of the evidence and the literature points towards balance and strength exercises in order to optimize your walking and prevent falls. So it is obvious that if your balance isn't good, that the chances of you falling over is fairly high. So people can have poor balance for a variety of reasons. So Priya's already mentioned how important your vision is for balance. So your brain actually integrates visual information to help guide how you're going to move as well. Other factors could include, pain could affect your balance. Having poor sensation, especially in your feet, can affect your balance. If you've got any other condition that might affect your brain. So there are a range of issues that can contribute to poor balance, or you could have just lost the skill of being able to balance over the years, and that just could mean, you're not out and about and moving as well as you used to. So then over time, what happens is, because you're not using that same level of balance, you lose it. So it is a use it or lose it situation when it comes to balance. So it is very important to do some balance training to improve your balance, and most people can, and that will help you walking significantly. You'll be able to walk better indoors, outdoors, and you'll be able to build up your confidence. And balance exercises, it's not something that you just do one time a week. Ideally, it's something that you should be doing, if that's deemed appropriate for you, several times a week. Strength is another important component of being able to walk. If you have weak muscles of your legs, then your legs might not be able to hold your body up, and then you might fall over. Or if you've got some weakness around your ankle muscles, you could be tripping over. So it's important to have that looked at. And if you do in fact have some weak muscles, your physiotherapist can actually give you some strength exercises to improve strength. And we know every year that you age, you actually naturally lose muscle. And I believe it might, don't quote me on this one, maybe it starts around when you're 50. So it's been happening for some time, by the time you head into your 60s, your 70s, your 80s. But the good news is that it is reversible as long as you do strengthening exercises. So it's quite positive, and exercises is definitely something worthwhile pursuing, and that's something that you should do for the long term, not something that you just do for the 6 weeks that you see your physiotherapist. Okay, so how to start exercises. It's very important that you ask your GP if it is safe for you to start exercising. And if that's the case, if you have quite specific problems or specific needs, then the GP might say it's better if you see a physiotherapist who will start you on these exercises. If you are healthy, active and fit, and your GP thinks, oh, going to a class will be fine. Because I'm based in New South Wales, I'm not as aware of what other classes are available in the other states. So for example, in New South Wales, we do have a website called Active and Healthy website, where there's a search engine where you can put in your suburb and it'll pull up the exercise classes in your local area and what sorts of exercises they do and some contact details. So if you are from other states outside of New South Wales, if you do see a physiotherapist, they should know about the local exercise classes, or ask your GP, or even speak to your local council to see if they're running, because they often do run some senior exercise classes, or they have classes for people with disabilities. Or otherwise, exercise physiologists also run classes generally, and your GP might know of one in your local area. Okay, so we've talked about mobility and exercise. So we're going to move to another factor that is important to address so that you can stay on your feet, stay strong, be active, as well as prevent falls. So feet and shoes are very important to consider. So as you can imagine, your feet are the bases of your body. So if the base isn't very good, then the rest of the body is not able to be supported when you're walking. So healthy feet is crucial. So if you're having trouble cutting your toenails or getting, checking your feet, applying cream, making sure it's well moisturized and looking for any, blisters, etc., then it might mean that you need to see a podiatrist so they can actually help you with your looking after your feet. Because ingrown toenails or bunions or corns or blisters or pressure sores of any sort will be quite painful. So if you're walking and you've got quite a bit of pain on your feet, that can affect your walking, disturb your balance. It can be quite problematic, and you need your feet when you're walking. Having well-fitted footwear is also important. So no slippers or flip-flops. You want footwear that's got quite a supportive back, like in this picture. You want shoes that the sole is thinnish, so you don't want a thick sole like you would have on sort of running shoes or jogging shoes, because you want your feet to be able to conform to the contours of the path or the flooring, and that actually gives feedback to your brain as to what you're balancing on. So that's important. You also want the tread on the sole of the shoe to be non-slip, so there should be some grip there. You want the toe box, which is essentially just the front of your shoe, to have enough room to allow for movement of your toe so it's comfortable. And you also want shoes where, so this one has laces, or you can get shoes with Velcro just so that you can adjust it so that the shoe conforms better to your feet. Okay. So Priya mentioned this earlier about medications. So medications are important for sure. There are just some medications that can make you dizzy or drowsy. So it is important that if you're having any of these side effects that you inform your GP immediately. And it's important that your doctor, your GP, reviews your medication list every 6 to 12 months to make sure that everything that you're on is still appropriate, still meets your needs, and isn't causing any of those unwanted side effects. So it is important that you have a medication list on you at all times. So, keep it in your wallet, because if the doctor that you're seeing is not aware of every medication that you're on, then they're not going to be able to do that thorough review of your list of medication. And a lot of the evidence does show that certain medications make you dizzy or drowsy, or if you're on a lot of medications, then that can be problematic as well. Okay, so moving on to home environment. So I guess we can talk about home environment as well as environment in general. So often, as a physiotherapist, through my many years of patients telling me about their falls, people will talk about how, oh yes, I've fallen because I happened to trip over this, this twig that just happened to be there when I'm out. But it's important to identify that the environment generally hasn't changed, and often you may have changed over the years, whether it be medical conditions that you've now got, or maybe your legs are weak or your balance is not as good. So therefore, of course, address those problems which I've mentioned earlier, but the environment has stayed the same. So it is then crucial to look at both modifying your environment as well as modifying your own capabilities in terms of your walking. So first question you should ask yourself is your home safe, which Priya talked about earlier. And I do have a link to a website that's got a checklist that you can run through just to see whether you've actually looked at every option. Because if you've lived in the same home for the last 30, 40 years, it is unlikely that you will identify all the potential hazards in your home because you're used to it, or you've been able to work your way around it. So it helps to then either, look at a checklist or have an external pair of eyes to assess the environment. So Priya's mentioned stairs already. So if you have stairs that have no rails, might be something to consider. Lighting, whether the whole home is well lit, whether there's lights in every room, whether you have a night lamp, say if you go into the bathroom at night time, because as Priya mentioned, your eyes are very important to give feedback to your brain to help you to balance. If there are any trip hazards, or if there are any, if you have any cords running through the house, if you've got pets who are not obedient, if your flooring tend to be on the slippery side, if in your bathroom you've got a really big hob you've got to step into and you don't have a rail in the shower, or you're struggling getting in and out of the bathtub, or you're struggling to get out of the toilet because there's nothing to hang on to. All of this you should take into consideration. And if you do identify certain areas that you think, oh, that could be safer, then you can ask your GP to refer to an occupational therapist who'd be able to do a home assessment and to identify all these risks and provide you with some suggestions as to how to address them or eliminate these hazards. Okay, so the last contributing factor I would talk about is not per se contributing to falls, although one aspect would. So healthy eating is important to remain active and healthy, because if you have a healthy and balanced diet, it's going to be good for your bones. So if you do fall, you're not going to break anything. Good for your muscles. Now you need your muscles if you're going to be able to balance well and to have strength in your legs. And it will also give you energy, and all of that's important for your own physical health and mental health as well, of course. So I'm not a dietitian, so if there are any specific questions, or if you have any specific issues, you might need to ask your GP to refer to a dietitian. But I will talk specifically about calcium and vitamin D. So you need calcium, which is mainly from dairy products. There are other food groups that can give you calcium, but dairy is the big one. You need adequate calcium and adequate vitamin D. So vitamin D you can get from the sun. So generally 6 to 8 minutes a day of direct exposure to sunlight. And you generally need, you can't just have your face exposed. You generally want, both arms or the legs exposed, and that's enough. And your GP can check to see if you've got adequate vitamin D through a blood test. And if you're not, even with the 6 to 8 minutes of sun exposure a day, then the GP might suggest that you take supplements. So calcium, vitamin D together, important for your bones. Keep your bones strong, which will help you stay on your feet, and make sure that you're not going to break anything if you do fall over. Having enough water and fluid through the day is very important, because if you're dehydrated, that might make you dizzy. So generally the rule of thumb is about 1.5 litres of fluid, and that could be water, could be tea, could be coffee as well, but that's important to remember. So like I said, if there are any issues, if you're experiencing any weight loss, struggling to eat all the right food groups, or have any questions to make sure that you're actually eating enough of everything, having a balanced diet, then you can ask your GP to refer to a dietitian. If you're actually having problems with swallowing itself, so you're finding that food is getting caught in your throat, or you're coughing a lot with eating and therefore you're not eating as much, or you're not eating much of certain things, then you might ask your GP to refer to a speech therapist who can assess your swallow and give you some feedback as to what it's like and how might you need to adjust your diet. Okay, so just to summarize, I just have here a falls prevention checklist, which I've talked about: safe walking, exercise, looking after your feet and having good footwear, reviewing medication, safe home environment, and healthy eating. So if you want more information for each of these, I've put up a link to the Staying Active on Your Feet booklet, which does go through all of that in detail and has those checklists. I was unfortunately unable to find an audio version. But I hope that answers a few of your questions, but I'll be able to answer your questions later. And I think I'll hand back over to Niv, and I'll answer your questions in a little bit.
Great. Thank you so much, Catherine. So thank you again to both Catherine and Priya for presenting today. It was really informative, and it was really great to hear, you know, what a role vision plays in falls, as well as ways we can stay active and healthy at home as well. So if you have any questions about anything that Catherine or Priya spoke about, you can type in a question, and just a reminder again, just click on the question icon and then type your question into the white box and then press send. So as I mentioned, if we can keep those questions quite general in nature, that would be great. And there's also no silly questions whatsoever, because no other attendees can see your questions. Only myself, Catherine, and Priya will be able to. So just before we move on to the questions, I'm going to briefly speak a little bit about what we do here at MDFA. So our goal is to reduce the incidence and impact of macular diseases. And we do have a number of pillars of work. The first being in prevention and early detection. We provide accurate, current and ongoing information. Just last year, we reached over 7,000 people giving talks just as this one, and we aim to increase awareness about AMD nationwide, increase awareness about getting regular eye tests, as well as generally just increasing awareness about macular diseases. The second pillar is in supports and services. Support for all patients, as well as facilitating access to other support services too. We are proud to be the voice of the macular disease community. It is a privilege for us to advocate for the very best interests of the macular community, whether that be designing policies for state and federal government or ensuring that medical benefits do not get cut. And lastly, of course, research and data. 100% of the funds that are donated to research go into our research grants program. And since 2011, we've given over a massive $4 million to 18 different research projects. So how can we help you? So you can always reach us on our toll-free national helpline number, which I've said multiple times, but I'll tell you again, is 1-800-111-709. And we can help you with any questions you might have, not only about falls prevention, but also about age-related macular degeneration or diabetic eye disease. If you have a question about Medicare or how My Aged Care works, we can also help you out there. If you know anyone who doesn't speak English as a first language, we can also provide translated materials as well. We also have a wealth of resources that we can send out to you, and you're able to view all our resources on our website, www.mdfoundation.com.au. So now I will go to the questions. I'll bring back Catherine and Priya, and we'll go through some of the questions that you've asked us today. Just get Catherine and Priya to come on. Here we are. Excellent. Great. So the first question here is for Priya. I have some of the risk factors you mentioned, but have not had a fall.
Sorry, Niv. Sorry, do you mind repeating that? I couldn't hear it.
No problem.
Sorry.
I have some of the risk factors that you mentioned, but have not had a fall. Should I be worried?
Thank you. That's a great question. It's great that you haven't had a fall. It's also about being aware of the risk factors in general and perhaps putting in some precautionary measures. So for example, if you've got a loose bit of carpet that you've kept looking at going, oh, I don't really like that, just get rid of it. If you've got low furniture that maybe a visitor tripped over, you just get rid of it. I think it's just being smart about any risk factors or anything that could cause a trip or a fall, any hazard. Yeah.
Okay, great. And a question for you now, Catherine. What balance exercises can I do at home?
Great question. So there are a range of balance exercises. It's hard for me to say specifically what would suit you, given that I haven't actually met you or assessed you. So all of my clients with balance issues, I'm able to actually give them balance exercises to take home to work on. But the physiotherapist should assess your balance first and then give you quite specific exercises, because the balance exercises are not effective if they're actually not challenging your balance enough. So it's got to be that right level for you. So I would suggest that you go and see a physiotherapist, have an assessment, and then you'll be able to get some to do at home.
Okay, excellent. This is a similar question, so I might modify it a bit. The question was, what strength exercises can you recommend in the home without special equipment? But I guess a modified version of that is, if the physio was to give strength exercises for them to do at home, would you need special equipment to do with it, or are able to do strength exercises just using your body?
Another great question. I love all this interest in exercise. Pretty much most of my patients that I see, I'm able to give them strength exercises that they can do at home without any equipment. Because if you think about it, body weight can be, for most people, fairly significant enough to actually give you that level of strength training. So don't think you need those equipments that you see in gyms. You can be given something that's fairly helpful to do at home.
Okay, excellent, great, thank you. And another question for Priya. What are the recommendations for sunglasses if someone has low vision?
Yes. So the low vision, the sunglasses we recommend for someone who's got low vision, it's not very different to the trendy ones that you find in your local shop. So they need to be very well fitted, so they sit all around your eyes. That's to make sure that no excess light gets in from either top, bottom, anywhere. They're sort of large as well, and they can be different levels of tint. It doesn't always have to be really, really dark. But as long as they're really well fitted, some of them can actually fit over a pair of bifocals or single vision lenses as well, but they have to be really well fitted.
Okay, and can you get those anywhere, or is there places that specialize in those much larger glasses?
Yeah, usually low vision services, they have maybe a shop attached to it that has different devices that you can trial, including sunglasses. They would be the best place.
Okay, excellent. And another question for you, Catherine. How can I encourage my elderly mum not to have a fear of falling or tripping? Sometimes she does not want to go for a walk because of this.
Okay, yeah, so fear of falling can be quite debilitating. So a number of my clients that I see with the fear of falling, what I find is when they engage in exercise and they actually improve their balance, which often involves them moving in ways that they are fearful of, but with the help of a physiotherapist, they get better at it. And then for them, that gives them a lot of reassurance. So I think exercise and seeing a physiotherapist will help with that. So yeah, explore that option first. Yeah.
Provide them with that, I guess, that extra support that's there to help guide them through it initially. Okay, awesome.
Yeah.
And then another question for you, Priya. What are the statistics in relation to falls downstairs in two-story homes?
Oh, wow. That's a girly one. Thank you.
For you.
So I shouldn't laugh. It's not a funny issue. So in the research that I did for this webinar, when I looked at falls and the research that was done in the elderly population, they did talk a lot about falls caused by steps or stairs. I didn't find anything that specified a two-story home, but I guess it's a similar sort of thing. If you've got steps or stairs, especially if you've got a vision impairment, you can't actually see each individual step. That is more of a hazard, and your chances of falling or tripping is increased. But in terms of specific stats, unfortunately, I don't have that.
Yeah. Okay, great. Here are some funny questions for you, Catherine. A lot about footwear. First of all, what brand of footwear do you recommend? Second of all, could you give me examples of well-fitted shoes that look pretty?
That's always a very topical question. I've been asked that many a time. So I guess generally, I would stay far away from running shoes, jogging shoes. I find most of the walking shoes, I'm not going to, I guess, advertise for a particular brand, but there are walking shoes that specify it is a walking shoe that's quite good. In terms of the range, there is a wide range, and if you don't have any specific feet problems, a general walking shoe would suffice, as long as they're ticking all those boxes that I talked about earlier. If you do have quite specific feet problems, your podiatrist is generally the person that knows a lot more about footwear, because they have access to that wider range. So if you do have specific needs about footwear, then you should see a podiatrist.
Okay, excellent. And a question for you, Priya. Should there be other light in a darkened room when using a computer?
Absolutely. If you've got a vision impairment, it's really important to have either the overhead lights on or a good lamp next to the computer. It'll help your vision. It'll also help you navigate out of the room. So if you stand up and you turn around and it's completely dark, it can cause disorientation and it could cause a slip or a fall. So really important I would have the overhead lights on, definitely. Yes.
Yeah, okay, great. And then one for you, Catherine. I don't have anyone to help me modify my home to make it safe. Is there an organisation who can send someone to my home?
Yes. If you go to My Aged Care, which is the government website, you're actually able to refer yourself for an assessment. So it could be an aged care assessor or a regional assessment service. And once you see them, you can specify that you want an occupational therapist to come to your home, assess the home, and then be able to help you with modifications. Yeah.
Okay, great. So My Aged Care. Okay, excellent. And that's a government organisation, is that correct, Catherine?
That's correct. Yes.
Okay. And then the last question, we have quite a few coming through. We've got to cut it at some point. The last question for you, Priya, is maybe not totally related to what we were talking about today, but is macular degeneration a DNA issue?
Thank you for that. There is definitely a genetic link when it comes to macular degeneration. So if you have a family history of somebody that has macular degeneration, you're at a higher risk of developing it. So it's really important to have that conversation with that family member about exactly what sort of macular disease they have. Is it age-related macular degeneration? And also to have an eye test as well. That doesn't mean that you're going to have the disease, but it's really good to have a baseline so you know exactly what your vision in the back of your eye look like. So if you've had any changes in the future, there's something to refer back on.
Yeah. Yep. Okay, excellent, great. So that concludes all our questions. Thank you so much, Catherine and Priya, for coming on and sharing your expertise. And thank you to all of you as well for asking all those questions.